I'm going to demonstrate how to make hematocrit tubes, set them up for packed cell volume, and how to do blood slides for a differential as part of a patient's CBC. So the first thing you need is a small sample of blood. Really, for 4 hematocrit tubes, you probably need only about 0.15 to 0.2 mLs of blood. And the slides, you essentially need a drop each. So I'm going to take off a needle. It's better to use the hub of the syringe rather than the needle. There's typically less chance of waste. So you just want to gently insert the tip of the crit tube at an angle, and just ever so gently push down on the plunger. And you're going to fill it till about probably a half an inch below the other end. So about that much left in it. And then you take your crit tube and hold the tip. Hold your finger over the one end of it, the opposite end that you're going to put clay, and you gently insert into the clay until you've got a nice amount in there. Some of the things that can happen is if you push too hard, you can actually break the crit tube in the middle. The other issue is if you have a clay with a lot of holes in it, do not make the mistake of smoothing it over like this and trying to reuse the clay. It doesn't work as well. Once a clay is filled with holes like that, just simply throw it away and get a new clay strip. It's okay to have a little bit of air in there. That's not going to affect the reading at all once it's spun down. Once it's spun down, there'll be a level of red blood cells and then a level of plasma up at the top here. And what you read is going to be the level of red blood cells, or the percentage of blood cells versus plasma in the crit. So we'll look at that. To spin down tubes, you want to place the crit tubes with the clay side pointing away from the center, so out towards the rim of the centrifuge. And you always want to balance it with another tube. There you go. If you put the clay side towards the middle, it's going to spin out all the blood and you won't have a sample. So you want to make sure that it's opposite the other tube and that the clay is towards the outer edge of this plate. Then always remember to put the top on. If you don't screw this on, the crit tubes will fly off and break. Make sure it's screwed down taut. You don't want to over tighten. Just as soon as you can't tighten it down anymore is when you want to stop. Push down so it clicks to make sure that it's seated properly. And always put the name of the patient on the top. And then you want to set this for 5 minutes and the blood will spin down. Okay. The next thing I want to demonstrate is how to make slides of blood smear. And the idea behind a blood smear is to create a feathered edge on a sample of blood that has a single layer of cells in it. And the best way that I know how is to use a simple slide and a cover slip to advance the blood across the top of the slide. So you want not very much blood at all. I can show you what is about the right amount. It's really not very much. More than that, and you run the risk of not creating a nice feathered edge with a monolayer of cells. You want to take the edge of the cover slip and at a 45-degree angle slide it back over the blood and very gently do that. And what you're going to get, I don't know if you can see that or not, is a feathered edge on the blood. Can you see that reflection there in the thing? Okay. So you want a nice feathered edge. Really, the whole sample shouldn't run more than probably an inch across the slide, and you'll get a nice feathered edge that way. And then you shake it or let it set to air dry. Usually, if you use a very small sample, it shouldn't take very long for the whole sample to dry. If you use a lot of blood on the slide so that the feathered edge is way up here, chances are the slide is going to be pretty thick and difficult to stain properly. So just make sure you have a very small amount of blood to create a feathered edge. You want to make sure that if you're doing a blood slide from a peripheral vein, that you use the uncontaminated stains. If you're using it for cytology, like some sort of purulent material, you want to use the contaminated ones. So these are specifically for blood slides. Put it in the fixative, which is the blue stain, and it's also labeled number 1. And I usually leave it in there to a count of 10. So take it, typically you count to 10, and that should be enough to fix the slide. And I'm going to show you when you rinse it, the top portion wasn't fixed and that came off, but the bottom portion was. So that's the difference from if you have too thick of a sample and it doesn't stain properly, that's what can happen. Okay. Once it's been in there, you dip it in here, and I usually just dip it slowly to a count of 10, and then you want to rinse the sample. And you can see the feathered edge on that down here. And then you want to dip it again in, we have clothespin that you can hold it with. You don't want to get any on your fingers. Dip it again. Get off the excess, and then rinse it again. And distilled water is best. And then hopefully what you have is a nice feathered edge there with a single layer of cells that you can examine microscopically. I would let it air dry for a few minutes, and then you can read the cells, read the slide. Don't forget to close these immediately following its use. These will evaporate quite quickly and will lose a lot of the stain that we would normally have, and they have to refill them frequently.